live and recording. Hey, it's Steven, your friendly neighborhood anesthesiologist and ICU doctor. So I am officially a month into fellowship. I just finished my first rotation. I was, if you saw the previous videos, in the Neuro intensive care unit. It was a good month. It was a really good month. I learned a lot about neurology and neurocritical care. I wasn't a huge fan of the brain before all this. When I have patients that had neurologic injuries, strokes, all the above, I kind of zoned out and didn't really know what was going on. So it was a really good month to kind of dig deep, learn from the neurointensivists, the neurology residents, the neurosurgeons, and how they manage these critically ill patients and the things that they considered in basically saving the brain, saving their life. And then, when things aren't going well, how do you call it quits? How do you know things aren't going to get better and things aren't going to improve? So that was month one, July. It is now August. I am now in the medical ICU, officially out of the Navy. July 31st was the end of my service obligation and commitment. So I am a civilian, veteran, what have you. What did I learn overall from Neuro ICU? I learned about management of traumatic brain injuries. I really kind of nailed down and understand better what happens in the cranium, when you have an insult, how the brain swells, how you lose blood flow to different regions of the brain, and some of those interventions that we do to help prevent or decrease the risk of damage being worse. So that was really good to kind of see firsthand. Probably the biggest thing that I learned from my month in Neuro ICU, I will never, ever, ever ride a motorcycle. No desire to do so. Motorcycles, ATVs. If you decide to ride a motorcycle or an ATV, please wear appropriate personal protective equipment or safety gear, wherever they call it. Wear the padded jackets. Most importantly, wear that helmet. I can't tell you the number of devastating traumatic brain injuries. Or I could tell you a number. I would see probably 3 to 4 of these traumatic brain injuries a week. And, I only worked days, so who knows what came on at night and didn't make it up through the trauma bay. A lot of these folks are dying in the field. Some folks are dying in the ER. And then some folks actually make it to the ICU, where we pronounce them in the ICU. Or, they have a very prolonged, protracted recovery. But it was a very, very sad, a lot of similar presentations where you have young, otherwise healthy dudes, and they're living their best life. They're out riding their bikes, their motorcycles, their ATVs, and, they hit something, they're launched into the air, they hit their head, and it is just horrific to see the damage of what happened, especially when you're not wearing a helmet and you hit your head in an accident. It's horrible to see the imaging of the brain just swelling, and, usually they can decompress it, but sometimes, if it happens too quickly out in the field, then the damage has already started to be done. And then you just have these super healthy young people that are brain dead. And it is super sad. You have a ton of family members coming in, sitting at bedside and, trying to take care of his loved one or be there for this person, and they're gone. Probably one of the saddest things that I witnessed this month, and just happened again and again and again. So, God, if you value your life, if you value your family, please wear the appropriate personal protective equipment if you're engaging in these activities, riding motorcycles or alternative vehicles and all that. The other thing I saw, number 2, high blood pressure. I really saw the end results of patients with poorly managed hypertension, the strokes that occur spontaneously. You just have your uncle, your mom or dad or whatever, grandparents living their life. Unfortunately, their blood pressure is not well controlled. Next thing you know, they have a stroke, and the sequela, the symptoms, everything that happens downstream of that are extremely debilitating. Ending up on ventilators, very prolonged, protracted recovery periods. I personally have a family history of stroke. A lot of folks in my family have had, they have heart disease, they have high blood pressure, they have stroke. And so something, I need to reach out and make sure, hey, uncle, auntie, are you taking the blood pressure medication? Make sure people are taking care of themselves, because all of a sudden they can go from just a chronic, poorly controlled medical condition to something that is extremely bad and can cause a long, slow death, if not a more quicker, faster death. Those are kind of the two big things. I got to work with residents, medical students that had just started. I took for granted that this is intern year for a lot of people. July was their first month being physicians. And here I am coming back after 4 years of practicing as an attending. And so it was a bit of adjustment, right? I'm adjusting to being a fellow and what is my role and what am I adding from day to day. And it took me, a week or so to realize, like, oh man, like some of these folks literally were medical students a couple weeks ago, and now they are interns or residents. And then there was medical students. And so I was able to kind of hopefully towards the end step into that teaching role and really add value and help them navigate the neuro intensive care unit. Really good people I met overall. I mean, one of the reasons I came back to the University of Chicago, everybody is super duper nice and friendly. I also got to, kind of spend a little bit of time in the operating room. I had a patient that had to go to the OR for surgery. So I kind of moseyed down with them and took care of them, watched kind of as they had their surgery. But overall, it was a good month. Got bounced around because back in the beginning, I had a co-fellow that was COVID positive. So I covered two days in the surgical ICU. So it's kind of a good trial by fire, get back used to the surgical ICU. And then I took 2 overnight calls in the cardiothoracic ICU to kind of get back up to speed on that patient population and seeing the really complicated, complex cardiac surgeries that they do here and how to manage the post-op complications. So yeah, it's good. Getting back to the swing of things. I can't believe a month is over already. Got to brush up my CV, start looking for jobs. But otherwise, life is great. I will continue to try to keep you updated and maybe do some videos answering some questions about military medicine. I think I got a couple of questions about that on the YouTube channel, so I can talk about that a little less filtered now that I am a civilian. So stay tuned. I'll try to get these videos up pretty regularly so you can kind of see what I'm up to in my anesthesia critical care fellowship. If it's something you're interested in, happy to chat with you as time permits because I am pretty busy. The first 2 months will be pretty light, and then I'm going to have really two heavy months, and it kind of alternates. But I'll do my best to keep you updated. And so until next time. Oh, yeah, the Black Doctors podcast. If you're following me, like the content or stuff that I do host the Black Doctors podcast. And every Monday we have new episodes that go out. And the goal is to create a sense of community and to start conversations specifically targeting Black healthcare professionals, pre-health professionals, medical students, residents, all of the above. We try to have something for everybody. And you can come and see how people before you that look like you navigated these healthcare systems and these spaces that may not be so safe and friendly. If you look at the first 2 episodes of this month, so in August, we were having a mental health panel, and we're hearing from some pretty awesome psychiatrists on the state of mental health in Black community and how, as Black healthcare professionals, we kind of are double, triple traumatized, having to deal with what we see in our patients and then what we experience ourselves. So if you have a chance, check that out, the Black Doctors podcast. It is available wherever you listen to podcasts.